Hello everyone, I am Shikaina Aquino Maranga and today I am going to perform open gloving and applying of sterile gown with closed gloving return demonstration. I am going to begin with the open gloving. The use of gloves reduces the risk of contaminating the healthcare workers' hands with blood and other bodily fluids. It also acts as a protective barrier to prevent the risk of pathogen dissemination between the healthcare professionals and the patients during clinical procedures. Now, sterile gloves may be applied by the open or closed method. The open method is most frequently used outside the operating room and for minor procedures when only the hands need to be covered. Now for the preparation phase, first I am going to remove all jewelries in my hands and wrists, this such as rings and wristwatches because microorganisms can lodge into the settings of these jewelries. Next, I am going to ensure that there is no artificial nails, extenders, or chip polish because this can also harbor microorganisms. Next, I am going to inspect my hands for sores and abrasions because the condition of the hand skin integrity may influence the effectiveness of hand hygiene, and proper skin care is essential for infection control. Now, I am going to ensure that my sleeves are at least 2 to 3 inches above my elbows. This is so that when I perform hand hygiene, my sleeves won't get wet. As we know, microorganisms thrive best in moist or wet environment. So now I am going to proceed with the procedure of donning sterile gloves. So first I am going to perform hand hygiene through hand washing or applying of alcohol-based hand rub. Hand hygiene is the most effective way to prevent infections. Failure to properly perform hand hygiene is the leading cause of hospital-acquired infections and the spread of multi-drug resistant microorganisms. After that, I am going to clear the table to open sterile field and raise its height to waist level. This is because only areas from our shoulder down to our waist is considered as sterile. Anything other than that is considered unsterile. Now I am going to inspect the packaging of my gloves. I am going to inspect its expiration date for the intactness of the package or of the packaging, for any tears, and that the packaging should be dry. After that, I am going to open the packaging by peeling off the top seam. Okay. After that, I am going to place the inner package into the working surface, open it up to see the right and left glove. So I am going to begin with my dominant hand for easier application. Now I am going to open the inner wrapper. I am going to ensure that I do not contaminate the gloves by only opening through the folded areas of the packaging. Now I am going to begin donning gloves on my dominant hand. So what I'm going to do is to use my non-dominant hand, pick up the glove for the dominant hand by only touching the cuff inside. I am going to insert my hand. I'm ensuring that I do not touch the outside portion since it's the sterile area. Okay. I am going to pull the cuff over my hand. Okay. And I make sure that the cuff doesn't roll off the sleeves and that my fingers are in its proper spaces. Now, next I'm going to don gloves on my non-dominant hand. So what I'm going to do is that since my dominant hand is already gloved, it means that it's already sterile. I can only touch the sterile portion of the remaining glove. So I am going to insert my hand into the cuff of the non-dominant hand. I am going to insert my non-dominant hand into the glove. Okay. make sure that the sterile area of the dominant gloved hand does not touch the unsterile area of the remaining glove. And okay, now after that I can now adjust as necessary. Since both are sterile, I can touch my other hand to adjust it. And after that, interlock the hands and make sure that it is at least 6 inches away from the body. This is so that we avoid touching unsterile objects and the front of our in the front of our gown. So for the doffing of gloves or the removing of gloves, what we would want to do is to grasp the palm or one edge of the cuff of one glove and remove it from the hand by turning it inside out. Make sure that as you do that, you do not touch the wrist or the bare hand to avoid contaminating the hand. So after that, I am going to place the removed glove in my remaining gloved hand. I am going to take the finger of my non-dominant hand, insert it inside the cuff of the gloved hand, and turn it inside out, bagging both gloves. Ensure that the outside part of the glove doesn't touch the bare hand, and completely remove it. Now after removing both gloves, we can now discard it in its proper waste receptacle. Okay. And after that, perform hand hygiene to remove the powder from the gloves, which causes skin irritation, and also avoid contamination caused by potential pinholes in the gloves. Now I am going to proceed with the applying of sterile gown and close gloving. Now, the sterile gowning and close gloving are chiefly carried out in the operating or delivery rooms where surgical asepsis is highly necessary. The closed method of gloving can be used only when a gown is worn because the gloves are handled through the sleeves of the gown. So for the preparation phase, I am going to remove accessories in my hands and wrists such as rings or wristwatches because microorganisms can lodge into the settings of these accessories. I am also going to make sure that I have no artificial nails, extenders, or chip nail polish because this can also harbor microorganisms. And I am going to inspect my hands for sores and abrasions, report to the supervisor as required because the condition of our hand skin integrity may influence the effectiveness of hand hygiene, and proper skincare is essential for infection control. Next, I am going to, prior to entering the operating room, I am going to wear my cap, face mask, eyewear, and foot covers. The cap and face mask is to prevent hairs and air droplet nuclei from contaminating the sterile work field. The eye covers is to, or the eyewear is to protect the mucous membranes of the eyes, and the foot covers is to reduce the risk of contamination from the shoes. Now I am going to open the sterile pack which contains the sterile gown, and I am also going to prepare the sterile gloves that I'll be using. Next, I am going to perform surgical hand washing, scrubbing if applicable, and applying of antiseptic agent or gel. So surgical hand washing is done before wearing the sterile attire to inhibit the growth of bacteria inside the gown and inside the glove. So after performing surgical hand washing, I am going to reach down to my sterile attire or sterile gown. I'm going to lift it up back away from the table so that when I unfold the gown, it does not hit the table and get contaminated. And I'm going to locate the neckband of my gown and ensure that I am only touching the inside portion of the gown. The gown is actually folded inside out, so I'm only touching the inside portion. I'm going to let the gown unfold with the inside portion towards me. Next, I am going to slip both my arms into the sleeves of the gown. It's quite difficult since I'm only using an improvised gown. And after that, I am going to ask the circulating nurse to have the gown over my shoulder and secure the waist ties in my back, because I cannot do it on my own, since the back is considered as unsterile area because it's an area where we cannot observe what's happening. Now after that, with my hand still inside my sterile gown, I'm going to open the packaging of my sterile gloves. Okay. The hand should be inside the sleeves of the gown to avoid getting the sterile gloves contaminated. And next, I am going to pick up the glove for my non-dominant hand. So I am going to extend the forearm of my non-dominant hand with palms facing up and hand still inside the sleeves. I am going to place the glove on my hand, palm to palm, thumb to thumb, and opening to opening. I'm going to hold or grasp the back part of the glove and the cuff of the glove. Next, I'm going to completely turn it over my hand. Okay, after that, I'm going to hold the cuff and the sleeves of my gown, pull it to properly extend my fingers inside the glove, and adjust as necessary. Now, after donning gloves on my non-dominant hand, I am going to proceed with my non-dominant hand. I am going to glove my non-dominant hand the same manner I glove my dominant hand. So I am going to pick up the remaining glove, extend my hand with palm facing up. I am going to place the glove palm to palm, thumb to thumb, opening to opening. Grasp the cuff of the glove. Going to completely turn it over my hand, and I'm going to pull the one edge of the glove and the sleeve so I can properly extend my fingers into the glove. Now I am going to adjust as necessary so I can properly extend my fingers into the glove. And now I am done. I am going to interlock my hands, and I am going to offer the waist ties to the circulating nurse so that I can finish up my sterile gowning and close gloving. So that is all for today. Thank you all for watching. I hope you all have a good day. Hey, just want to give a mega shout out to Dear and Cheryl. Hello guys.